What do I know about the HPV vaccine? Hi, Winifred A. Winston. I know a lot about the HPV vaccine. It is was originally brought out and recommended for adolescent females. Well, guess what? HPV causes the human papilloma virus, which is a precursor to a lot of cervical cancers in women, which is the reason that you get a pap smear. The point of the pap smear is to determine whether you have changes in your cervix that are consistent with cervical cancer. So it was found out that HPV is directly related to that, and an HPV infection can predispose you to cervical cancer or oral cancers. But somebody also had the epiphany, wow, if young adolescent girls are getting HPV, where are they getting it from? I wonder. Young adolescent boys. So then it was recommended that young adolescents, male and female, all get the HPV vaccine. But then they were saying, okay, it was recommended that you get it, say, between 12 and 15. Then somebody said, well, what happens if you're older than 15 and you're sexually active and you're concerned about catching HPV and possibly getting cancer from it later in life? Maybe we can use the HPV vaccine in older individuals as well. And now it is available for older individuals. If you are not in a monogamous relationship with a single partner, then you are susceptible to capturing and being infected by HPV. So the HPV vaccine is a reasonable weapon in your armamentarium to protect you from that. So if it's something you're interested in, yes, again, it's readily available. Insurances will cover it. So not a problem. HPV vaccines, human papilloma virus that protects you from the most virulent. And there are multiple strains of HPV, but there are about 8 to 15 that are associated with cancers. They call them the high risk variants of HPV, and the vaccine protects you from those high risk variants of HPV. But remember, again, there are a lot of people that are getting oral cancers, throat cancers, etc., from HPV vaccinations or HPV infections, rather, of their mouth and throat and their oral. And that's because of oral sex. Everybody's having it, everybody's doing it. And so any place that's pink and moist, inside a woman's vagina, inside a man's penis, inside your mouth where it's pink and moist, then it is susceptible to the viral infection, and that's where this vaccine comes in. So more information, talk to your primary care provider or your GYN to discuss having the HPV vaccination.